Right now, a controversial new group of vaccine advisors is meeting at the Centers for Disease Control and Prevention in Atlanta for the second day. It's the first time they've convened since Health and Human Services Secretary Robert F. Kennedy Jr. dismissed the entire previous panel of experts. And we're learning right now they're taking aim at long-established guidelines for vaccines that have been proven very safe. And that includes vaccines for hepatitis B, measles, mumps, and rubella, and even chickenpox. Let's go live right now to CNN medical correspondent Meg Terrell, who's outside the CDC in Atlanta. Meg, we're learning the advisors have already taken what was being described as a key vote this morning. Walk us through where things stand.
Yeah, well, this is the first time we've seen this panel of advisors take a vote, and these votes are very influential for vaccine policy and insurance coverage in the United States. So they voted on a new shot to protect babies against a really dangerous virus for them called RSV. This is the most common cause of hospitalization among babies. It's a respiratory virus that affects babies typically in the wintertime. And this is a new shot from Merck that was already approved by the FDA. And there are already some forms of this intervention on the market. And one pediatrician panelist called this really spectacular in terms of the results those have already shown in reducing hospitalizations for babies. So this was really expected to be something that should receive full support from this committee. What we saw was a positive vote, but it was split 5-2. And there were a lot of questions brought up around safety of this shot that the FDA, the CDC panelist, and the company all said had been well studied and were not actual concerns. And so that revealed some of the tensions here that we are seeing with this newly appointed committee. We also saw a lot of questions about flu shots this morning. These are influenza vaccines that have been around for decades, are very well understood in terms of both their safety and their efficacy. And so sort of revisiting a lot of those questions are things that the public health community is worried about with this panel. And finally, right now, Wolf, there is a presentation going on that's raised the most eyebrows. It's about a preservative called thimerosal, which was taken out of most vaccines back in 2001 as really a precaution. There had been no safety issues surrounding it, but after that, a lot of advocates started questioning whether it was tied to autism, which has been shown no link, Wolf. So that's what's going on right now. Back to you.
Lots going on, Meg Terrell. Thank you very much. Meg's over at the CDC for us. For more on all of this, we're joined now by Dr. Fiona Havers. She's an epidemiologist and vaccine expert who spent 13 years at the CDC. She most recently served as a senior advisor on vaccine policy and resigned last week in the wake of Health Secretary Robert F. Kennedy's purging of the agency's Vaccine Advisory Committee. Dr. Havers, thanks so much for joining us. Tell us a little bit more about your decision, first of all, to leave. What was the point of no return?
No return for me was when RFK Jr. fired the 17 members of the advisory committee that makes recommendations to CDC about what should be on the immunization schedule. RFK Jr., since taking over as HHS secretary, is now using government power to limit access to vaccines. And the purging of this committee was really the last straw for me. That was the moment where I knew that I really didn't have any faith that the data that CDC puts together was going to be evaluated fairly by whoever he put in place.
And I know, Dr. Havers, you've actually said that a lot of Americans potentially are going to die from vaccine-preventable diseases as a result of these latest changes. Who is most at risk?
I think in general, young children, we're going to see a return of vaccine-preventable diseases that we haven't seen in this country before. We've already seen 2 measles deaths since RFK Jr. took over as HHS secretary. That's a disease that was eliminated in the United States, but we're now seeing large outbreaks. I think infants are going to be vulnerable. We may see infant deaths increase for pertussis, and we potentially see a lot of other diseases we haven't heard of, like diphtheria and rubella, come back if access to vaccines is limited and vaccine confidence continues to go down. Also, I think older adults or people with underlying medical conditions are going to be at high risk, and we'll see an increase in deaths from flu and COVID-19 if vaccination rates in older populations go down, for example.
This is also so worrisome. I want to get your reaction, Dr. Havers, to this new panel that's now sitting and just making these major decisions. What do you see as the most troubling aspect of these new appointments?
Well, I will say that one can see from my CDC colleagues' presentations that they gave yesterday and today how thorough and evidence-based they are. I will say that there were a number of questions from this committee that really revealed a lack of basic understanding of methodology. There were some questions this morning around the RSV vote that really just showed that the people on the committee who were voting on these products really didn't understand how serious RSV was in young, healthy babies, for example. And I'm also really troubled that this presentation that's going on right now by Lynn Redwood is happening on thimerosal. That is an unprecedented type of presentation to happen. Never before have I seen a private citizen invited to come and give a sort of overview of the evidence that has not been reviewed by the work group. There's a work group for every vaccine, type of vaccine that's not been reviewed by the work group and hasn't been vetted by CDC. The type of presentation she's giving is usually given by a CDC official after a lot of clearance. And the fact that she is presenting in this very well-respected, previously well-respected public forum is just yet another example of RFK Jr.'s interference in CDC's vaccine policy process.
Dr. Fiona Havers, thanks so much for joining us. And thanks, by the way, for all your service at the CDC over the years. We really appreciate that as well, your service in helping to save lives. Coming up,